Hello everybody. Here we will be talking about hypoglycemia, which is dangerously low blood glucose level, a value below 70 mg/%. We have talked that the glucose levels have to be kept in a steady state in the blood, and when it falls below a particular level, it can become harmful. Normally, without diabetes, this is very well regulated by insulin and the other gut hormones. They work together and keep the sugars in a very close range. But we cannot mimic that when we are treating you. So when we try to achieve tighter controls, there is a possibility that you slip down and develop hypoglycemia. So it's an inseparable part of diabetes management and something which should always be kept in mind. So the target sometimes may need to be titrated. Ideally, if we treat you, your sugars should come back to normal range. That may be impractical because of the risks of hypoglycemia. And those people who are higher risk, we may set a little lax target. So an HbA1c slightly on the higher side, maybe a fasting PP slightly on the higher side, only to avoid hypoglycemia. This should be well understood and the targets should be individualized depending on the risk for hypoglycemia. What happens if my sugar below 70 or so? Well, my body will show some symptoms. They are called adrenergic, which is the excitement that we have, the adrenergic system when it is activated. And what is that? Sweating, palpitation, tachycardia, tremors, sometimes even hunger. And this should alert us to the presence of low blood glucose, especially if you are being treated. If we ignore these, then the sugars can drop even further, and whereby the sugar delivery to the brain decreases, and that is called neurogenic symptoms. It is one step worse than the adrenergic symptoms. You may start feeling dizzy, there may be clouding of consciousness, or you may fall unconscious, may not be able to help yourself or call for help, and this can be lethal. If the hypoglycemia is prolonged, very severe, there could be permanent damage to the brain. And this is something which really scares us. Even the adrenergic symptoms can scare somebody. You have started on an anti-diabetic medicine or insulin and you start experiencing these adrenergic symptoms, or it may dissuade you from getting yourself treated. But if you know it from before, you know that this is a part and parcel of management of diabetes. Symptoms are vague. They may be happening in many other conditions as well. How do you know it is due to hypoglycemia? Well, you check your sugar levels, and that is where glucometers are very handy. You just have it at your disposal, check it when you like, gives you a result in less than a minute, and you see symptoms, low glucose and recovery by intake of glucose. This is the triad which fulfills hypoglycemia. You surely know that this was a hypoglycemic episode. Some people may have sugar lowering below 70, may not have any symptoms, but they should also be careful. Either their body is so made that they are not showing any symptoms, or their systems are diseased, so much so that they do not show any symptoms. So the first thing that can happen with you is severe hypoglycemia. You can directly go into coma without experiencing any of the adrenergic symptoms, and it is more likely if you keep ignoring them. So never ignore any symptoms which could be suggestive of hypoglycemia. What do? You need to take care then and there. If you are conscious, you take 25 to 50 grams of glucose in any form, sugar or syrup or anything, but this is the amount that you need to take. Always when you are treated with diabetes, make sure you have access to glucose. Maybe 100 grams of glucose, keep it in your car, bag, workplace, home, wherever you are, so that you have this at your disposal whenever you need it. It's something which has to be done urgently. Sometimes if you can fall unconscious, what should be done then? Well, the people who are in and around you should know. Some people wear tags, maybe they can carry certain slips in their purses, or some kind of directive to someone that, okay, I am diabetic, I am taking medicines, this can happen to me, take me to a nearby hospital. People say you can rub some kind of sugar on the tongue, or maybe give some kind of liquid sugar. I don't know. But what this means is, if you become unconscious, you need to reach a medical facility at the earliest. The hypoglycemia may be prolonged. It depends on what drugs you are taking. So it can last for maybe few hours or days even. So whenever you have hypoglycemia, you need to seek medical attention. If it is a severe one, you will require hospitalization. What are the risks that I can develop hypoglycemia? Oh, one risk is the management itself. We cannot regulate sugar as good as the body does. But the others are age, advancing age, cognitive dysfunction, metabolic disorders, reducing muscle mass, nutritional disorders. All these will predispose you to hypoglycemia. Illness, we are not able to take orally, or you kind of cannot match your medicine or insulin to your blood sugar levels, because this is one place where sugars can go high, sugars can go low. You need to have a glucometer and some kind of guidance to manage you through any kind of illness. Comorbidities. Well, we talk how liver maintains the blood sugar level. So if your liver is diseased, you're an alcoholic, not taking meals properly, you are at greater risk. Or you have kidney disease, two major disorders, kidney and liver, which can cause dysregulation in the insulin function and predisposes you to greater hypoglycemia. Or when the targets are unrealistic, you are being someone for very strict control, and in trying to do so you develop hypoglycemia. So the target should be realistic. Drugs, yes, like insulin. It is very, very likely to cause hypoglycemia because it's a powerful agent. Among the oral drugs we take for diabetes, some have greater propensity for hypoglycemia, some have lesser. But potentially all of them have. You should know your drugs. And the drugs may have to be adjusted according to your hypoglycemia risk. Uninformed, when you do not know anything about it. You're taking a medicine, you're taking an insulin, but you have no idea about hypoglycemia symptoms, you don't know when to check your blood sugar, you don't have a glucometer at your disposal, oh, you are at a higher risk. And that is where glucometer is very, very helpful. Okay? If your sugars are high, you still have time, you can reach a facility, get a test done. When your sugars are low, you need a glucometer to give you an exact idea. If you don't have glucometer at that point of time, still make sure you take glucose if you have any of the symptoms, and then you can check your sugars later on. All is not bad about hypoglycemia. There is some good news, and that is that sugars are at least coming down. People who have poor control of their blood glucose levels, who have never reached their targets, they will never experience hypoglycemia. Can we live like that? Well, no. We need to get you treated to as close as possible to normal without causing hypoglycemia, and that is where it requires a lot of understanding and participation of the patient, especially when they are taking insulin or medicines which are very likely to cause hypoglycemia, and also patients who are at risk. No need to fear it. The whole idea is to know about it, manage it, have a glucometer at your disposal, and reach medical facility whenever you think things have gone out of hand. It could be dangerous, so that you get medical attention, and then plan next. Then what caused the hypoglycemia? How can I adjust my medicines or my food to make sure that I do not have in future? So the ideal diabetes control would be stay in range, but without developing hypoglycemia. And just in case you happen to have hypoglycemia, you should know how to manage it to minimize damage.